Hi there, Dr. Tansavatdi here. If you're listening to this video, this is because you've had your rhinoplasty or septoplasty surgery and you're here to listen in on the postoperative instructions. You should have received some instruction sheets at your preoperative appointment, but I'm going to go over some of the top key points so that if there's something that you forgot, you can come back to this video to listen in again. So first thing I'm going to do is highlight the days after surgery. So the first day, day 0, I'm going to call it, day 0 is the day of the surgery. So after the surgery, you're going to be there in the recovery center for about 2 hours. After that, you're going to be going home. Hopefully you have a ride, you have somebody to stay with you that night. I do advise that you have somebody, your friend, family member, be with you that first night because you are going to be under the effects of general anesthesia, so you may not remember all the instructions. So have them review this video too if they have any questions. So the first thing that first night is you're going to be icing. That's the only thing you need to do. No other things with stuff that you have to apply or do anything to the nose. First night is putting on ice. And I'm going to give you a tip here. Instead of ice, because ice can be heavy on the nose, I would prefer rather using a wet washcloth that you dunk it into ice water, wring it out, and you use that washcloth and apply it right over the face, particularly on the cheeks, not on the nose particularly, but it can lay over the nose just fine because it's not heavy. So that's what I would recommend. The first area where you're going to possibly bruise, if we did any bony work, is right along the cheeks and the upper eyelids. So after that, you're going to ask me, well, how often? I would recommend doing that once every hour for about 20 minutes, and that's all you have to do. When you go to sleep at night, you don't have to continue doing this. So I don't want you staying up through the night and not getting enough sleep, because sleep is important for your recovery process as well. So you want to get enough sleep, enough rest. So not icing while you're sleeping, but only while you're awake. Okay, the other things that you're going to be doing is you should have been starting the Arnica and Bromelain before surgery, and that's 3 days before surgery. Well, you're going to continue doing that. So I know some of the instructions are very confusing. Sometimes it says start it right after or start it 2 days after. My recommendation is going right back to it. Unless you feel nauseous from the general anesthesia, then I wouldn't do it. But if you don't and your stomach can handle it, I would take the Arnica and the Bromelain that first night. So it's Arnica is 3 times a day and it's 3 tablets. The Bromelain's 2 capsules 3 times a day. And remember to take the Bromelain on an empty stomach. If you can't handle it because you're a little nauseous, again, that's the first one that I would stop is the Bromelain. Now, day 1. So day 1 is the following day. The following day, you're probably going to have a post-operative appointment with me. I don't know what time that might be. It may be early in the morning or maybe in the afternoon. But I do want you to start the Afferent Sprays, whether you come in to see me in the morning or not. So right in the morning, the first thing you're going to grab is the Afferent Spray. It's supposed to be used 4 times a day and just for the first 4 days. So how I would like you to use it is morning as soon as you wake up. The next thing would be lunchtime, afternoon, or dinner time, and then right before bedtime. So that's your 4 times a day. So it should be about 6 hours, 5 to 6 hours between each spray. That's going to help open up the nose so you can breathe better because it's going to be quite congested. Imagine that all this work, let's say you did it on the skin, right after surgery, it will swell. So the same thing is happening inside your nose, so it's going to be hard to breathe. The Afferent's going to help that because it's a decongestant for your nose. Now, on the instructions, it says something about saline sprays. You're not going to do that until after the Afferent sprays are done. So day 1, Afferent, morning, lunch, dinner, and then night, bedtime right before you go to bed. Then between all those times, you're going to remember also to ice. As we said before, you're going to use the cool compresses using the washcloth that you dunk in ice water. And you're going to do around the clock every hour as you're awake. Once you fall to sleep at night, you don't have to do that anymore. You're going to resume your vitamins as well. And also don't forget your antibiotic. So I forgot about that. The first night, you're going to take your 1 antibiotic before you go to bed. The following day, you're going to resume your antibiotic, morning, lunch, dinner. So that's 3 times a day, and take it with food. Don't forget to take that with food. So that's day 1, day 2, day 3, day 4. You're going to repeat all that I've said so far on even the icing. Now after the 4th day or so, the icing is not going to help. It's most effective the first 3 days, and then after that you can just stop doing that. If you have the time and you're bored, hey, I want to do something, you can do that. It's not going to add that much benefit, but it's not going to hurt as well, so you could do that as well. The other thing I want to talk to you about before I get to day 7 is what you might experience the first few days. You may experience some mild depression. That's normal. Especially if you look in the mirror and you go, oh my gosh, I'm so bruised, I'm so swollen, what did I decide to do? A lot of people start questioning themselves. Did I make the right decision? You know, our thoughts will start to wander, and that's why it's great to have somebody that you know, your friends or family, that support you through this decision, so you can talk to them and they can help allay your fears. So the mild depression can be a normal process. Bruising's normal, so bruising in the upper eyelids, around the cheeks, that bruising is going to start to come down your face, so that's a normal process as well. The other thing is that you're going to want to make sure you take all of your medications with food. So if you do take some narcotics for pain, you're going to want to take that with food, because if you take it on an empty stomach, it can make you nauseous. There is also a mustache dressing that first day when you leave the hospital that you're going to continue once you go home, because there may be some blood that trickles down. That mustache dressing, you're going to continue for the first 24 hours. When you come in to see me that first day after surgery, I may take it off and you might not have that much bleeding, and I'll tell you, you don't need to continue it. If there's still a little trickling, you can continue it, but know that most of the time, by 2 days out from surgery, it'll stop, so you won't need to do anything. Now the Afferent can help if you do have an active bleed, and I do want you to call. These are some of the instructions on when to call. If you do have active bleeding that continues and it doesn't stop, the first thing you're going to want to do is take the Afferent and spray your nose, because that decongestant also constricts the blood vessels, so that will help to slow down the bleeding. If it continues after that, then you're going to want to call us, because we'll want to take a look. I will want to take a look, because if the bleeding can be controlled, I'll take care of it. Sometimes, occasionally, it requires more treatment than that, and so it's helpful to call us as soon as you find that the bleeding is not under control. I will say the majority of the time, though, the bleeding stops on its own, and I will say not never, there's not ever always a never, but there's very few times I've ever had to take a patient back to the operating room. So that's the first few days. Now, after we've talked about the first few days, we're talking about day 6 or day 7 is when you'll be coming in to see me to remove the cast. If I did put a cast on place, that will come off. It's either tape or cast, and that will come off on day 6 or 7. At the same time, we'll take sutures out. Some people will ask me, can I take a pain medication before I come in? That's definitely helpful, because it will help so that you're not having as much pain. If you're driving, you can't take the pain medication. If you do have a driver, that's very helpful to take the pain medication, so it will help control the pain when I take out the sutures. Occasionally I put splints inside the nose, and those will also come out at the same time. And then after that, occasionally I do tape the nose again for an additional week, but most of the times I don't. So you should be able to see the results of the surgery right at that first week. Now, after that first week, I occasionally will have a second week appointment as well. That 2-week appointment, and then after that, a 1-month appointment. So those are the things that you will need to know what to expect after surgery. The other things that I'm going to highlight are just some other tips that I want you to know. The upper lip's going to feel a little numb sometimes, as well as stiff. So some people have trouble talking, and that's normal. The other thing that you'll want to do then for that is to eat soft foods for the first 3 to 7 days. It will help make it much more comfortable in the recovery process. I talked about the Saline Spray earlier. The Saline Spray you're going to start using after day 4, and you're only going to use it as needed. The first week or so, it may be still very runny and you won't need it. It's usually after that first week when you come in and I take the splints out, the nose is going to start to dry up, and there's going to be a process for a few months as the nose is recovering that the saline sprays are going to be helpful. The other thing that you may want to get from the store, and that's something that I will prompt you if I find that it's pretty dry, is saline irrigation that you can get from Costco. is one place you can get, but you also get online, and that's called NeilMed, the name of it. It's NeilMed sinus rinse. So that's what I would use. Other people have called it neti pot. That's another name for it. So those are irrigations that you do, salt water or saline irrigations for the nose. And then last few things to point out so that you remember to call us if these are some highlights of one of the top things to call us about. Fever, if you have a fever at home and it's not being controlled with Tylenol and it's pretty high, what's high? Well, that would be 101 or higher. So if you do have a fever, call us because that could be a sign of infection. Second, if you're having a lot of bleeding, as I alluded to before, the first 24 hours is normal to change the mustache dressing once every hour. But after that, if it's continuing, then you need to call us. The third thing is if you're having a reaction to a drug or medication that you got, so that would be a rash, any itching, any signs that this could be an allergic reaction to the medication, then you want to call us for that as well. So last pointers on sleep and activity. So because I didn't go over the sleep process, we talked about while you're awake. So while you're sleeping, the key point is to sleep with your head elevated. So you're going to need to prop up some pillows. That means that your head should be higher than your heart. And that's to help that the swelling comes down. So if you sleep and you prop all these pillows behind your head, that's going to prop your head up and it's going to be a very bad process for your neck. So you really want to prop the pillows underneath your back. So that's 30 degrees elevated. Think about a reclining chair. So that's exactly the type of height that you want. In addition to sleeping on your back, I get questions a lot about people sleeping on their back and they're not usually back sleepers, and so it's very hard for them for the first 3 days, 3 nights. So the thing that I suggest is if you're a side sleeper, one recommendation is propping some pillows off more on one side so you can sleep a little bit to the side and still elevated, but that you're not completely on the side because we don't want you resting on the nose. The second thing about the sleep process is if you've got a big bed, that's great because whoever you sleep with, your sleep partner, you want to have enough of a distance because we can't guarantee how they're going to be moving in bed with you. And so if they potentially elbow you in the nose, that's a no-no. So the first week is going to be crucial that you avoid any contact or close contact with your loved ones, babies, dogs, because that could potentially be something you couldn't predict, that they could hit you in the nose. And then last thing about activity. So activity after surgery, the first 24 hours is hard because of the general anesthesia. So you may feel groggy, you may feel tired, but after that, I really want and encourage you to get up and walk around the house, do as much normal activity as possible, not lifting heavy weights, but going back to your normal routine, because we want you to be moving. The more you move around the house, the more you move your legs, you're getting good blood flow, and that's going to help with the swelling, to decrease the swelling. So thank you very much for tuning in.